President Trump signs an executive order intending to dismantle key parts of the Affordable Care Act. I'm Bryn McBride of ABC for Health. We're talking about an order today that impacted the association health plans and short-term insurance. Let's keep our attention for now, however, just on association health plans. Let's remind ourselves what they are, and then we'll talk about what the order is intending to do. Association health plans are actually groups of similar small businesses banding together to purchase insurance. You can think of if a lot of little bakeries all got together, they're similar businesses, and they decided they're going to negotiate and purchase insurance as one association. You see this a lot with farm bureaus as well. The order that we're talking about today asks federal agencies to look at ways to expand the use of these association health plans. It would treat the associations essentially as large employers. They are not subject to the same rules as small employers or to the same rules as individuals. Now, up until the signing of the order, when we could actually get our eyes on what that order actually said, it was questionable whether individuals would be allowed to opt into some of these associations. It seems for now that that won't be a possibility, that it'll just be small businesses able to band together to purchase insurance. Now, the order is going to exempt the core ACA protections, and this is what happens when you follow the rules of large employers as opposed to the rules of small employers. For example, you do not have to follow essential health benefits, and these are things we're talking about like newborn and maternity care, emergency services, mental health and substance abuse services. You also don't have to follow medical loss ratios. Now, this is the rule that says how much of your premium dollars actually has to be spent on your own care. Questionable whether or not these large group employer plans, essentially these association health plans, will have to follow things like lifetime limits and yearly caps, or charging more to those who are sick if there's going to be a prohibition on that. The Affordable Care Act actually does regulate some of the rules about group and large group insurance. Not all of them, but some of the rules, such as keeping your child on your insurance up through age 26, depending coverage. Large group insurance has to follow that rule just like small group or individual insurance. They do have to stick to annual and lifetime caps. Now, the detail here of this executive order is going to come in the drafting of the regulations. The rule is not immediate. It doesn't take effect right away. New regulations need to be drafted, and the devil will be in the details. Which part of the Affordable Care Act protections that apply to large group plans are they going to follow, and which ones are they not? Are they going to write in new restrictions, or are they going to broaden it out? Because this is going through that regulation writing process, it's going to be the Department of Treasury, Labor, and Health and Human Services that are charged with writing these regulations. That process means that we get a public comment period. That comment period might be cut short, as we've seen with other executive orders dealing with healthcare topics, but nonetheless, the process will slow down otherwise in order that we would have been fearful could impact open enrollment that runs November 1st through December 15th. It is looking like right now that because of this process of the executive order, the need to draft new regulations, and the need to follow rules of public comment periods, there will be nothing in place for this executive order by the end of the calendar year. So we think we're okay through the end of the calendar year before this takes effect. That doesn't mean that there aren't risks to the Affordable Care Act. That might be a little bit longer term. And we're talking about things like bypassing state regulations and federal rules here. We're talking about creating different pools under different rules, worse coverage for cheaper. And if you ask most healthcare policy experts, they're going to tell you this is the bad old days of insurance. We're going back where we say you don't have to follow the essential health benefits. You can pick and choose what coverage you want to offer under this plan. Does it make some of that coverage a little cheaper? Sure, but then what happens when the people that you're insuring get sick or start needing necessary medical care? It's not going to be covered, which means out-of-pocket expenses and big bills. At the same time, if you're offering cheaper insurance with bare bones coverage, you might be harvesting people out of the individual market, Obamacare's individual market, people that need comprehensive coverage. What does that do to that individual market? It leaves that market as the place for the more expensive, maybe not as healthy purchasers. So you start creating different pools, different rules for different pools. You have a healthier pool, cheaper insurance, a sicker pool following essential health benefits and coverage mandates. What does this do to the Obamacare marketplace? Most people are telling you right now it's going to destabilize it. This has the opposite effect of stabilizing the marketplace and making sure we can connect people to affordable yet comprehensive coverage. We don't want to start creating more risk pools here, and that's exactly what it's looking like it's going to do. You can read the order for yourself. It's a little bit high on rhetoric and low on details, but you can at least see the language coming out of the White House. You can then tune into some of these articles of interest. We've got a lot of folks in the media talking about this, a lot of healthcare policy experts weighing in as well. We share a couple of those resources. You can keep your finger on the pulse and stay connected with us. You could share your healthcare story, send us an email, or ask us a question. If you're watching us on YouTube, you can like or share or subscribe to our channel. You can always visit us at healthwatchwisconsin.org. Thanks.